Well, it is day 2 of the 21st International AIDS Conference in Durban, where thousands of health experts, politicians, activists and researchers have converged to discuss the global response to HIV. Critical issues are under the spotlight, and officials are hoping that this year's conference will inspire new ideas in the fight against AIDS. Our reporters have been covering the conference for us, bringing us all the interviews and analysis. And for more now, we cross to our reporter Ayanda Mhlongo, who's live from Durban. Ayanda, a very good afternoon to you.
A very good afternoon to you, Natasha. I tell you, it's still very much a buzz of activity here at the Durban ICC. Delegates are locked in deliberations. It's session to section, plenary discussion after plenary, as you was talking about the top science. We've got policy makers who are here discussing the way forward in the fight against HIV and AIDS. Now, earlier on, from the morning, in fact, my colleague Blaine Herman has been speaking to some of the scientists and those who are organizing and responsible for this conference. But another voice that is very, very important in a conference like this is civil society. There are a number of civil society organizations that are part of this conference. You know that in the fight against HIV and AIDS, they play a critical role down on the ground with the communities. We're talking about NGOs, CBOs, non-profit organizations, and one organization that's really been a leading force in the fight, campaigning for access to treatment, is the Treatment Action Campaign. They were here in 2000 when the conference was first held here on African soil, and they are back again this year at this conference. The TAC has continuously over the years continued to campaign for access to treatment, has continued to secure government fund or government to provide treatment to thousands and thousands of HIV positive people, and that's why we now stand at about 3.4 million people in South Africa alone are now on ARV treatment, and KwaZulu-Natal has more than 1 million people who are now on treatment. Now, joining us to tell us about the involvement of TAC in this conference, I'm joined by Nkhensani Mavasa, who is the national chairperson of TAC. Nkhensani, thank you very much for joining us. 2000, the TAC was here. 2016, you are back. Take us through the journey from then to now. The access to treatment, where are we?
Okay, thank you, and thanks for having me. Yes, we were here in 2000 campaigning for the treatment for people who can access treatment, where we won the ruling where the government was forced to provide treatment for all people. So we are here today because in South Africa, only half of the people who are HIV positive who are accessing treatment. So we still have half of the people who are not accessing treatment. And we know that based on the study that has been conducted, when people are put on treatment and then they get healthy, and then when their CD4 count is high and the viral load is undetectable, that person is less likely to transmit the virus to the next person.
Concerning 3.4 million people now in South African treatment, of course you say that there's still thousands more that still need to access treatment, but what have been some of the challenges or the bottlenecks with regards to getting people on treatment?
Yes, most of the things we find that previously there were problems when it comes to waiting list, where many people will find that they are not accessing treatment due to the waiting list, due to the places where they are supposed to go and access the treatment. And also another thing, the issue of testing. You find that at the healthcare facilities, the equipments are not yet there. And even now, we're still having those kind of challenges because we find that people are defaulting because they can't access the health facilities where they're supposed to can get the service.
Just on that, drug stockouts, and I know that even at the South African AIDS conference last year, the TAC was here. They spoke about certain provinces where there were still challenges. Take us through which provinces, has there been any improvements in those provinces, and where are we now? Are we seeing more drugs now available at health facilities?
Yeah, regarding those challenges, yes, they were there in most of the provinces, and we tried to advocate for that. We even gave the report on which are the provinces were most highly likely affected. And currently, yes, there are improvements, even though the challenges are still there, but there are improvements.
As the TAC, you've been advocating for interventions to be married with human rights. Take us through that, and why have you been fighting so much for this intervention and human rights?
Because HIV, it's a challenge to the human rights, and for people to access treatment is accessing healthcare services, and of which is a constitutional right. And therefore, when people are not accessing the services that they're supposed to, it means then their rights are being violated. So there's no way we can isolate when people are affected or infected by HIV from the part of human rights, because it's still their human right for people to access the service.
Nkhensani, your reaction, the new rate of infection is quite alarming. Adolescents between 15 to 24, obviously that's going to add a burden on treatment.
Yes, definitely it will. We know that currently South Africa has approved the test and treat model, of which is going to start on the 1st of September. But the challenge is, how is that going to be possible? Because currently we are having the challenges, even with the people that are accessing treatment now, in terms of adherence, in terms of accessibility. Therefore, it means putting those other people to get treatment, then it's going to be a challenge again.
All right, Nkhensani, thank you very much. I'll have to leave it there. Nkhensani Mavasa, the national chairperson of the TAC. And with that, I know we've run out of time, but we'll continue to give you all the latest news and developments coming from the 21st International AIDS Conference. And Natasha, it's back to you.
Ayanda, thank you very much. Our reporter Ayanda Mhlongo live from the International AIDS Conference.